September is National Prostate Cancer Awareness Month, and for men who are proactive, they can prevent the worst diagnosis. Joining us now is Dr. Robert Pugash. Good morning to you, doctor. How are you?
Good morning. I'm fine. Thank you for having me.
Oh, of course. So let's talk a little bit about the minimally invasive treatment you have for prostate cancer.
HIFU, or high-intensity focused ultrasound, is actually a treatment that's been around since the 1990s. In the U.S., it became available in late 2015, and it allows treatment of prostate cancer without the typical side effects seen with surgery and without the high recurrence rates that we can have with radiation. So it allows men now who have been afraid of either being diagnosed with prostate cancer and then afraid of treatment for prostate cancer to now come in to have this cancer treated at an early stage before it causes significant side effects.
All right, and what differentiates this treatment from traditional prostate cancer treatments?
Well, some of the older treatments like surgery, even with robotic surgery, have significant side effects, the most significant of which is leakage of urine on a permanent basis or urinary incontinence. That changes the quality of life for us on a daily basis, and is the major reason why a lot of people decide not to have treatment for their prostate cancer. The problem is when treatment is delayed, the cancer grows and it spreads. And we're seeing an increase in the number of men coming in with advanced prostate cancers that are no longer curable, and we have to put them on medications which also cause side effects.
Wow.
With a HIFU treatment, this is an outpatient procedure. It takes anywhere from 2 to 3 hours to perform on average. Men go home with a small tube or catheter for about a week or two. They have no pain after the procedure, and they're back to normal activities much faster than with surgery. If men choose radiation for prostate cancer, oftentimes that's a 6 or 7 week program, meaning they have to come into a radiation center every day of the week for that 6 or 7 week period, and the recurrence rates are very high. So HIFU is revolutionary in that it allows simple treatment of prostate cancer without the side effects and prompt return to normal activities.
Wow, yeah, only seeming to impact you for a couple weeks at most. So why is it important for men after 50 to get screened for prostate cancer?
50 seems to be the time when prostate cancer increases significantly in its incidence. This year in the U.S., we're going to diagnose almost 250,000 men with prostate cancer. And unfortunately, the prostate cancer death rate is going up because men are delaying diagnosis. So 50 is a good time to start screening. If someone is of African-American descent or Scandinavian descent, we typically start screening earlier at age 45. And if there's a family history of prostate cancer, then the likelihood of getting prostate cancer is much higher. We start 5 years before that. The youngest patient now with a diagnosed prostate cancer is actually 28.
Wow.
I had prostate cancer several years ago, and I knew I was at high risk because a family member of mine had had it. I had the HIFU treatment, and years later, my cancer is gone. I have no side effects, and that's what we look for all patients who have a HIFU treatment.
Okay, I think everything you just said just encourages people to go get screened. Please, where can we go for more information?
HIFU Prostate Services is the largest provider of HIFU in the country. So starting there is an excellent way, but any local urologist can certainly evaluate a patient for that. It's a very simple 5-minute evaluation. It's an examination of the prostate. It's a blood test called the PSA. We do a free and total PSA, and that should be done once a year. Prevention of prostate cancer is difficult, but diagnosis at an early stage is not. So it means coming into your doctor once a year for the evaluation.
All right, Dr. Pugash, thank you so much. We've got the information up for PacificCoastUrology.com.